Alright, in this last tutorial about WRVUs, we're going to talk about the WRVUs for service versus a procedure. And I took a prototypical service, new outpatient visit, billed at level 4, and I took a prototypical procedure, a VASCath. You'll notice that the WRVU is 2.43 for the service, 3.72 for the VASCath. So at face value, it looks like you ought to do more VASCaths if your contract and your salary is dependent on the amount of WRVUs that you accrue. In the second video, we looked at time, and we realized that it would probably take us 30 minutes to see a new patient to bill at level 4, but 60 minutes to do a VASCath. And if we saw 2 patients in that same amount of time, we'd have a WRVU about 4.8. much greater than 3.72. That's one reason why a lot of practitioners will choose to see more office patients and perform less procedures, which is generally done in the hospital, because you can see more patients and get more WRVUs if that's the way you're being compensated. Here's another way to look at why service might be better in accruing WRVUs than procedures. And for that, I'm going to change colors so we can get a better look. You only get 3.72 WRVUs if you succeed, because there's 2 things that can happen with a procedure. You either succeed or you fail. And if you succeed, you get your 3.72 RVUs, and if you fail, you get 0. Now there's something similar here on the service side, but it's not succeed or fail. You don't succeed seeing a patient or fail in seeing a patient. You either see the patient was present for the visit, or you don't see the patient was absent for the visit. So if you schedule a 30-minute slot for a new outpatient appointment, the patient shows up and you bill level 4, you're getting 2.43 WRVUs based on 2013 data. If they don't show up, it doesn't matter what you were planning on doing, you get nothing. So the question is, how do you increase the likelihood that you'll succeed? Well, that comes from better training and more practice and a little bit of luck as well. How do you increase the likelihood that a patient will show up? Well, you don't have to have the patient show up. You have to have a patient show up. And in order to get a patient to show up, one of the best and easiest ways is what's called the overbook of appointments. This is one reason why so many physicians overbook, because they don't need a specific patient to come, they just need a patient to come, preferably a new patient to come. In the case of a VASCath, the only way you can get these 3.72 WRVUs is if you succeed. And success is based on your talent, your skill, the time that you have to do the procedure, and a lot of luck. And these are things that are not easy to manipulate. In the case of the service, you can get your 2.43 WRVUs outside of anything that you have to do per se, outside of your skills, outside of your talent, outside of anything that's inherent to you. All you have to do is book more patients, and you're probably guaranteeing yourself at least one patient will show up for that 30-minute slot for you to get your 2.43 WRVUs. So that's another reason why lots of practitioners favor the services, especially outpatient services, over the procedures, because it's easier for them to get the WRVUs that they need to boost their salary. And that's it for the tutorials on WRVU. Thank you very much.